back to Close Up. You know, it's always a campaign issue, but while the candidates talk about their plans for improving health care for our veterans, others are taking matters into their own hands. One example of that is Hospitals for Heroes, and behind the effort is the host of New Hampshire Today, Jack Heath from WGIR Radio, and Tom Raffio, the president and CEO of Northeast Delta Dental. They are my next guests this morning. Gentlemen, good to see you.
Good morning.
Jack, let's start with you. I mean, this was born out of the Veterans Choice. Take us through it.
Well, so the show, I had some veterans on that were explaining to me, Josh, that they're being sent out of state for basic procedures, medical procedures that could be done right at a local hospital in Manchester or the Seacoast, Keene, North Country, South. And it's so I just thought that was outrageous in this day and age that a veteran who served this country, served this state, has to go to West Roxbury, Massachusetts or White River Junction to get a knee or a stent put in for a heart, and when they could be done here. So we started this effort with Catholic Medical Center was the first, and through the show and just the power of advocacy and a couple Senate hearings in Manchester and the listeners, we basically got all 26 hospitals in the state of New Hampshire signed up and pledged to be Hospitals for Heroes. What that means, simply put, is their providers have gone through the hoops to be VA certified, and a veteran can go locally through the Choice program instead of having to go out of state. This past year alone, since we started this through the show, 545 veterans in Manchester alone went to CMC, and the year before it was just over 100. So they're starting to use the Choice program to go locally for something versus out of state.
Now, Tom, you're the CEO and president of Northeast Delta Dental, as I mentioned. How'd you get involved in this?
So then, Josh, I heard the show, and I also heard a veteran call in saying that the VA denied him benefits, the ability to have oral health taken care of, because he couldn't prove that the dental issue occurred while he was in active service. So I heard this. Jack calls me on commercial break. I line up a couple of dentists, and now we're seeing Dr. Mitch Correa and Dr. Greg Tracy see veterans, and then I established...
They're veterans themselves, correct?
Correct. They're veterans themselves. They've done a lot of for veterans in pain. They're doing a lot of free dentistry. And then I worked with our partner, Delta Dental Plan of California, and we now have a program for very inexpensive veterans can get a dental home through a program called VA Dental Insurance Program, or vadip.org. And so a lot of veterans are now signing up for a traditional program, which is very inexpensive. So they can get a dental home. And meanwhile, we continue to see veterans who are in pain through Dr. Tracy and Dr. Correa.
A lot of people don't think of dental care as being important to overall health, but boy, is it.
Yeah. Anybody that's seen me in the community always hears me say, and every speech, with you can't have good overall health without good oral health. There's so much connectivity, and you can't eat if you don't have good teeth as well. So there's a lot of those connectivities.
Let me patronize Tom. We had veterans on the show calling, saying that for months or a year or two have been trying to get surgery, and they had headaches and neck pain, and this was from their service, but they couldn't prove it, or they hadn't been a POW. That's actually another benchmark. They said after calling Tom's office, his private line, in 2 days, after a year of waiting, they were getting surgery. And I met a veteran who came in the station lobby. He's in tears, just hugging me, thanking me. I said, it's not me. You served. We're just paying it back. Right. But, Josh, you know, we have one of the highest per capita veteran populations in America. We do not have a full VA service hospital. So my hope is through the Hospital for Heroes that the veterans can go locally and not go out of state. I mean, we've reached that point where if you can, and it's covered by the Choice program, why go 2 hours out of state for a surgery? Yeah,
I mean, I love the work you guys are doing. If there's one issue that's near and dear to me, it is taking care of our veterans. Conceptually,
thank you for your service.
Of course. Conceptually, the idea of Veterans Choice Card is great. You know, you have a card, you go to any hospital. There's hurdles, though, that still remain. What needs to be done? What are the challenges?
Well, I know you had Congresswoman Ann Custer on, and I know she's supported veterans, and it's people like her in Washington that I think have to keep the pressure on the insurance arm of the VA that was contracted to pay the providers. I mentioned the 545 veterans in Manchester at that one hospital. That hospital came on my show, pleased to do that, but they're owed $2 million from that insurance arm of the VA. Some of that money is 90 days out. A small provider, one of Tom's dentists that has to pay bills, pay the lights, they can't float that bill. So people in Congress have to keep the pressure on the VA to speed it up, stop trying to fight the Choice program, let it succeed. It's working, and you can have the best of both, the VA and these private facilities.
And Tom, you guys have been trying to bridge the gap as much as you can.
Exactly. That's the great thing about New Hampshire. I put aside the politics. We got Dr. Tracy, Dr. Correa to see the veterans in pain, and we set up this new program again called vadip.org, and it's working. So I kind of put the politics aside, and thanks to listening to Jack's show, we got this little network in place, and it's working well. And as Jack said, says, every day I get a couple calls from veterans who say their mouth has been repaired, and it's not just self-esteem issues. Again, it's that overall wellness that we need to have.
To hit home, one of the veterans that Tom helped, and I don't think I told you this, but and talk about the New Hampshire way, he said that he was apprehensive to smile around his daughter for 8 years because of the damage he had had. And after he had gone to your friend, Dr. Mitch, he said that first smile with her, and of course he was just emotional. But you know, you hear those stories, and we owe it to him. We owe it.
I mean, it's a life changer. I mean, you just talk about vanity, but sure, if you don't want to smile.
It's not about entitlement. The veterans earned it.
Yeah,
they earned the care, but they're not ones that are really good at putting their hand up asking for help.
I want to get your take big picture, whether it's this issue or something else, the way you guys are going about it, and that's basically starting with the grassroots and then bringing in the federal government, talking to Andy Kuster and other members of the delegation. I think that's proven to be more effective to a certain degree rather than asking the candidates to fix these things and then they don't know where to start.
Josh, you interviewed every one of these candidates. You moderated the debates. I won't say one who won the Republican side. He was pretty attentive to this. I talked to all of them. You talked to all of them. Half of them running here didn't even know. This state opened their eyes to veterans care, but it's all across the country. What happened in the Phoenix VA a couple years ago, White River Junction, Manchester, good men and women who work at the VA. I want to be very clear about that. Many of themselves veterans. But you have to have the collaboration of the private sector. No offense to the federal government. Innovation, cell phones weren't made by the government. It was made by, they were made by, entrepreneurs.
Sure.
Innovation has to happen from the private side with the public, and I think we can get it fixed.
Right. And the great thing about New Hampshire is we have Dr. Mitch Correa and Dr. Greg Tracy. They're veterans themselves. They understand. And they understand, of course, the importance of oral health. So we've made it happen. We definitely want to sensitize the government to this. It would be great if the VA would see veterans, even if the veterans can't prove that the oral health issue occurred while they were in active service. But we now have a mini solution that's working.
And real quickly, another veteran called my show live, and he said on the air, he said, Jack, no disrespect to people who are in prison. He said they can go down to the county prison and get dental care. He goes, I serve this country. I've been trying for a year to get dental care. Why do veterans need to even wait that long? That dental care should be covered. It should be part of what they get.
Yeah, and Tom, I imagine, you're a bit of a trailblazer in this particular area. Are you reaching out to other
well, I think
companies?
I think we've become a benchmark for other Delta companies across the country, and again, the establishment of this dental program, and again, it's called vadip.org, so veterans across the country now have access to that program, and again, it's through our sister plan, Delta of California, so it's now becoming more of a national program as well.
Wow, and big picture though, Jack, and I know you're working on this a lot when it comes to the veterans, whether it's homelessness or reintegrating back into society, some of the younger veterans. This isn't a single-pronged, problem. There is a framework that needs to be built to help these veterans get back on their feet.
Josh, I want to thank you. You've helped me twice and your station, but you in particular as a Marine, as a great guy in broadcast who I think does great work.
Thank you, bud.
You've been on the Radiothon a couple times with me. The people I interviewed, that's a 12-hour show that we did on the station network to help Veterans Count. By the way, Veterans Count, great organization through Easter Seals, vetscount.org. And the young veterans that I interviewed coming back, yes, we have more work to do. We're just talking about physical care, the emotional wounds of service. Some of our National Guardsmen, 6 tours of duty, some of these people, away for the holidays, serving time and time again. They come back with invisible emotional wounds. We're not even talking about that. And that's the next shoe to drop. And almost every veteran I interviewed for that 12-hour radiothon that you were helpful on, I didn't bring it up. They mentioned PTSD, the number of their colleagues who have taken their own lives, 22 every day in this country. And through what we're doing in New Hampshire, we don't want them to take their own life. They need to get the help they earned. It's not about entitlement. They earned it. Service, tour after tour. They come back. How do we expect them to be the perfect wife, the perfect husband, the perfect employee when they've been over there in hostile land serving us so we can be free in the live free or die state? So a lot more work to do. And I worry about the emotional side next. That's something that if the VA's been behind on physical care, the emotional side's next.
About 30 seconds.
And Josh, let me put a shout out for Veterans Count. That's become also a national benchmark for other states as well. And it's not it's those emotional needs, but it's also the little things. Life goes on that has to be taken care of. And Veterans Count, big shout out for them.
We got to run. And if anybody wants to help, you can call into Jack's radio show, New Hampshire Day. Guys, good to see you. Happy Thanksgiving, and talk to you more.
Thanks, Josh.
Thanks, Josh.